what have we done? Anything?
No, we haven't done anything.
Lovely.
It's a virgin face.
So perfect. And honestly, for working out so much, you haven't lost that much volume. Sometimes you'll see all the bodybuilders, I mean, you know, the bodybuilders, and you see them on camera or when they have their spray on stage, and they have some nice, really crazy flat malar creases where their bodies look amazing, but their faces are kind of divoted. So you've maintained some good volume in your face, so you haven't lost everything, which is great. Yeah. So remember that your goal is you're either enhancing or you're altering. And you have to decide before you ever touch a patient which one you're doing, right? You can't just guess. So for male patients, you want to make sure that there's a lovely transition from their frontalis down through their temple and then down to accent their jaw. If you're trying to feminize a male, then you can do their zygomatic arch and zygoma. But for the vast majority of males, you want to maintain this good integrity and highlight it. So you want to be really careful as to when you're adding a little bit of volume through here, you don't want it to give that much of an OG curve because his jawline should be more important than his cheek structure. So I think we can use a combination of two in him because you have a good zygoma and zygomatic arch, good jawline. Some of that could also be like you cheat and put your lower face hair. How old are you?
37.
37. So he's been aging for 7 years. He's cheating a little bit because he works out a lot. And he honestly has good volume in his face, right? So we want to maintain the integrity of his structure. Look at that good transition from your frontalis to your temple, down to your cheek, down to your jaw. Unless we were choosing to feminize him, then we would highlight and make an OG curve. But what we want to do is help this compete with this just a little bit, keeping it nice and masculine. So you can see the parameters. Here's the upper portion of his zygomatic arch. Here's the lower portion of his zygomatic arch. And I think for him, a combination of a tiny bit of HA for some detail work, maybe a little bit of define to help this nice wrinkle coming, and then some global Sculptra. And then Sculptra can help him because he's going to keep, like, I'm sure you're still going to be in fitness and such, right? So he's going to keep building his muscle mass, and some of that can wear down on his face. So Sculptra right now will start kind of planting the seed and helping him to build collagen and give him a little bit more longevity than what he can do on his own, even though you've only been aging for 7 years. So, do you all draw hinders lines, no hinders lines? Does anybody know what hinders line is?
I do the hinders line. Just
you do?
Sometimes it's for the patients that they feel like that, you know.
Connection.
Yes.
We're doing something.
Yes.
I know. So hinders line, you want to go from lateral nasal ala to either mid or upper tragus. Do you happen to have a 4x4? I'm going to take off your numbing. Actually, I'll be nice and leave it on that. I'll take off your numbing on that side. So hinders lines, you can go straight across. Don't mind my not so perfect line. And then you can go corner of the mouth to the corner of the eye. And hinders line serves two purposes. Number one, it helps you see symmetry, right? You have 4 quadrant distribution, so if you can't see symmetry on your own, this can kind of give you a guide. And it does help you also see your maximum point of projection. In a male patient who wants to look masculine, you're not going to accentuate that much unless you have a depression. If you have a depression, then you need to make it into a neutral. But what it does not do is tell you where to inject, right? It just shows you symmetry and maximum point of projection. That's it. So on this side, okay, so we're going to start on that zygomatic arch, and honestly for him, I don't need very much at all. I do just want to help keep what he has and maintain that flatness. So I'm going to use just a little bit of contour coming in this fashion. I'm not going to put any here. Do you see his good volume? He already has. Smile for me. Smile. See how he has nice volume right there? And then relax. And then he's missing a little bit of the volume deficit here. So in this triangulated area, I will 100% put a little bit of contour. And then I'm going to start with Sculptra, and I'm going to think globally. So I'm going to start from the bottom, get his little wrinkle right by his ear you never knew he had. And then you're going to go all the way through the cheek, from lateral to medial. Now, he really has great fat pads, right? He doesn't have, you would imagine a guy who has 8% body fat would have a deficit here. He really doesn't. It looks nice and flat. But if he did, or females who do, or they have those, like, 9 nasolabial folds, lateral, you can 100% help those and fan right under that. So I almost do serial fanning coming forward, and we can even do nasolabial fold, and his lower face volume actually looks really good. You definitely probably have a hypertrophic mass. Do you grind your teeth a little? Or like, you're just always in tense mode, right? Yeah.
Definitely that.
I can see it. So we're gonna help the rest of his face maintain and not deflate while his muscles holding the volume for his lip. Yeah, see, perfect. Any questions? It's nice to have a change in a gentleman too, so you can see that like the world is your oyster. All you have to do is enhance or alter, and for him, we're enhancing. He already looks good, we're just gonna make him look a little better. So I'm gonna start lateral, and I'm gonna help build his periosteum.
They're using contour for the periosteum.
I am, and I'm gonna use contour because he almost is
Has
nice
that
and
ex-
flat.
yes, yes.
So I want to keep exactly what he has, just accentuate it a little bit. So when you're starting, you want to make sure that if you start where that zygoma and zygomatic arch kind of intersect. It gives you a wider frame. It's more predictable. So you go straight in, you feel a little pinch. Perfect. Pull back, and you can see it in expression technology, the bubble comes back through the product. You don't have the whole thing coming back, and that's because it's expression technology. And then I'm gonna go ahead and do maybe about a 0.1 or less. That looks great. And so now I'm gonna trace myself going back, and I wanna maintain the integrity of his anatomy and just give a little highlight to his zygomatic arch to help him out. And honestly, since his body fat is so low, I'm not gonna put a whole lot. I don't need his cheek to pop out. I need it to maintain and just look better.
Not that it doesn't look good right now.
It looks 7 years of age. It's age 7 years is what I mean, right?
So you don't start aging till you're 30?
Right, in theory. But you do start losing collagen when you're 20. I sort
I've
of,
been training for 21 years.
there you go.
So how?
So you were building muscle while you were losing collagen starting at the age of 20. You were starting earlier, but your collagen was falling off. But do you see how now that's a lovely continuation?
Yes.
And we're gonna pair that with that Sculptra coming out and forward. So let's jump next to the Sculptra,
Is there a reason you didn't use lift here?
because lift will give me even more projection, and for him, my goal is not projection. If he had so much of a deficit, or I was trying to feminize him, then yes, I would use lift. You could also use lift in tiny aliquots, but contour will mold with him and still be able to give us some three-dimensional volume. And it'll, while this is not moving, as I put it medially, it'll move with him.
Yeah.
And so for people who don't have a lot of body fat, you're gonna see more muscular movement in their face.
Okay.
So the nice thing, it's not usually contour or lift, it's usually contour and lift.
Lift.
But he really doesn't need, if he was 10 years older, you'd probably use both.
Yeah.
So see how that water has already kind of softened? So you
It
can imagine
softens,
you do
yes.
one side, and then the other side is already looking better once you're done, you know?
Yes.
So I say don't waste your time standing there massaging
Yeah,
it or
yeah.
panicking, and don't show them. They don't need to know what they look like until way later.
Wait.
Okay, so we're gonna start laterally and see how, you
I
know,
have a patient, they have their phone and they're recording their own. I'm like, stop it.
you are such a nice person.
No, I'm stop it. I'm like, I'm not touching you until you put it down.
I'm so mean. I'm like, no phone, no camera, no nothing.
Yeah.
You do nothing. Like, or you're distracted.
Leave it
right?
outside. You know, we should have a locker. Leave everything there.
Isn't that nice? Like when you come in, drop your phone
Drop your
here.
phone.
Yeah, unless you're on call.
Yes.
So we're gonna start laterally, and I always start lateral to medial, and the reason being is you will see people start here, but if you remember, your vasculature will jump over your mandible at the medial portion of your masseter and then move medial. So
That's the patient
I don't
actually.
want to be anywhere in that same, I don't want to be perpendicular or in that plane. So if I'm lateral, I can probably, even if I happen to hit an anomaly or anatomic variation, I'll be transecting, I won't be in, right? So here you go, little pinch, perfect. And then I can make a nice retract, and then we're gonna make it a little fat and ugly. So for a hot minute, you're gonna tell him that you're gonna feel a little fat. I always tell patients you're gonna get
No, he don't like ugly. Be good.
fat and ugly, yes. You're gonna get a fat face before you get a fabulous face, especially if I'm doing 3 vials in one hit, right? That's a lot of fluid and a lot of water.
We need water on the face.
When do you
I've
see
been
that
dehydrated.
going down, the swelling from the, or the,
I'm always sweating.
So
Happiness.
I try not to say like swelling, because it's not true swelling,
water.
it's just water.
Oh, yes,
So
yeah,
almost
sorry.
like getting an IV. I'll say like, do you feel any different when you have an IV? No, you just go to the restroom. It's the same idea. It'll get reabsorbed. By the time they leave, it'll look better. So let's do nasolabial fold. So I still love 1.5 for nasolabial fold, because with one pinch I can get to here. I can make a bolus on the top if I want to. I cannot make a bolus on top if I don't want to. But single insertion point, see how I can pick it up and see where I am, but you cannot see the gray. pull back and make sure I'm not within anything. I'm gonna do a bleb on the top.
Make sure you're aware of the angular artery over there. So that-
And then inject and retract. Yes, everything you want to avoid. So that's almost a whole vial in 3 insertion points. So that's also why I love Sculptra. It's a little less tedious too, because you're covering a larger area with less injection points, even though it looks scary. So it's cheating because it's November, whatever they call
November,
it.
yeah,
No
November,
beard,
no
no
shave.
No shave.
No shave, no.
I was
Yeah.
like, I hope they don't make me shave my beard.
Yeah.
So we're gonna start implanting a little bit of seed to make sure he builds collagen, so that when this is over,
Yeah.
he's still gonna look better.
When the November is over and you shave, then it
Yes.
doesn't look awkward.
Yes, you don't
Or
look
otherwise
good
you'll have
and
to keep
bad.
that.
So maybe tilt your chin up a bit, and that gives me better range of motion. And so for hairy areas, I love to use, you can use alcohol, but it's not as,
I use the antiseptic spray first to get the whole things clean and then use the alcohol.
but HipaCleanse is
Yeah, that's what I
sticky.
can.
And HipaCleanse will almost look like a gel, and hair is historically dirty.
Okay.
So with HipaCleanse, you can get a nice, you'll ruin their face for a hot second. Same thing around like temple. Last little bit, and you're down on the side. And here we're just helping that transition point, keep his good projection on his chin, and build some collagen in that weakness. I remember 15 to 20% of people have their inferior labial artery in that mental crease.
Yes.
You want to make sure you don't hit that at all. Halfway done. Did I make you cry? Kinda. Sorry. So you can do, he honestly has good volume. He just needs neurotoxin here. And what's this line coming right here? Anybody know what that is? See this line right here? From here to here? Correct. That's him and all his fault. That you're not going to fix this. You're not going to fix this today, not tomorrow, not
No,
ever.
we can fix it through the other techniques.
What is it?
No, you honestly can't. You can make it look a little bit
Yeah,
better,
it's better, yeah.
but if the human head weighs way too many pounds, and how many hours of sleep do you get at night?
Don't lie.
5.
Okay, 5. Still, 5 a night, that's gonna be, he's doing this all night, every night, whether you like him or not. There's no amount of filler or anything else that can help him. So you can definitely make it look better. But you don't promise anything, because this is his fault. You're halfway done.
That's good.
And see, he doesn't look remarkable, he looks great. Sit up for us to see a second. See how now that lower face can compete with that zygomatic arch. He still has great definition in the front. And remember, all of this right now, he's gonna look a little chipmunky. That's just our water. It'll go down and it'll build some collagen for him, so he will have a better transition. Fabulous. Okay, other side.
Just
Perfect. You always want to start a little more medial. Build your self-confidence. Don't start at the harder area, because if you miss it, you won't be so excited. That zygomatic arch has zygoma, then zygomatic arch, and tapers as it gets closer to the ear. So if you start back here, you may feel like, I just can't find it. Usually when you can't find it, you are slightly below it. You don't want to come all the way out. Come out, redirect, and angle your needle up, and you'll usually find it.
I feel like a crunch.
I know, that's on the bones. It
Yes.
looks great.
So that they feel or can hear is their
The periosteum, like when you go to the bones.
oh, don't say the bad word. Is their vibratory sense. They can feel the movement. They can hear the movement against their periosteum. So just know that's normal. And it's almost like when you have headphones in and you're like chewing and it's amplified, you know. So just know it's normal. Hopefully you have music on, thus you're gonna hear it even louder. But reassure them and say like, it's not you, it's me. I'm wondering it. Don't worry.
Yeah. And sometime in 60, 70-year-old, it's more than that.
It is. It's so bad. Like you need to.
I
Oh,
feel
this
like
is so good.
Yes.
Fabulous. So we're gonna work our way. I'd say blend just a hair more from here to there. Gonna highlight your tattoo. Perfect. That's great. And you can see with contour, you really don't need a lot of massaging, right? If you wanted to give you some three-dimensional volume, the only time I would massage with contour and with lift is when you could hopefully learn to not put too much. You can always put more. That looks great. Love it. And then smile for us. We want to see it in animation, and then relax, smile again, and relax. I say we put
Yeah,
like
yes,
two
yes.
more little dots
Yes, yeah,
right
yes.
where he's weak, and you're good. And then I am going to have huge Ultra. So you can use our 3cc cylinders. Here's an 18 gauge, and here's yours. So I'm going to this 3cc. Oh, there you are. Thank you. So you can put it right there.
I always
Yes.
apply pressure, especially when someone's.
Am I bleeding everywhere?
Yeah.
That's perfect. See how it
You're used to bleeding, so
do,
you
like,
should
three of
not
them,
be
and then
the
just hold it shut.
one complaining about
That's where he's
it.
going. See how like it just carries it
But
out?
look good.
Beautiful. And now this side, look at this side. How good does that look? It's already gone way down.
Okay, so we're
So
going to
last bit we're going to do half on the nasolabial fold and the other half on the lower face. Almost pretend like you just have a filler syringe.
small.
It is, it's a 1. You're out of 1.5 here. Okay, that is great.
So when would you use a Sculptra on the nasolabial folds instead of a filler? Is it patient choice?
Combination is king. You're the professional, you're the one who knows, and the answer is combination is king. So likely you're going to do nasolabial fold, Sculptra, and filler at different times. If they have a wedding, they have an event, they have a show, they have a whatever, a birthday, then maybe I need some HA first to give them some immediate gratification, but I 100% need to get something to build their collagen in there and some fertilizer at some point. Never let a patient choose. A patient can choose what they inspire for an outcome. A patient doesn't understand what polylactic acid is versus hyaluronic acid versus like CAHA versus anything.
So
I one time went to...
you inform the patient?
No, you can. I'm not saying don't inform the patient, but if you want to sit here and go through all the drugs in portfolio with every single patient, you're going to be out of business in a hot minute. You know what I mean?
Another point to note is like
know?
I've been notifying it, explaining them everything, and then
but you can't. I mean, the more you grow your portfolio, the harder it's going to become. To
Exactly.
You have 15 types of peels and 23 types of filler. So we sit down and talk about all of them, or are some of them irrelevant because they don't pertain to you? So I am selling an outcome, not a thing. Never let your patient choose. They can agree. They can choose whether to do it or not, and they can also, like sometimes with lips, we're talking about when people are picky. If you're an artist, you can see in millimeters, or a machinist. If you're an artist or a machinist, you can see in millimeters. I actually welcome those challenging patients who want to fight with me, because that means that I have another set of eyes, and that makes me even better, where initially I wasn't that excited about it. But yes, perfect. So now we're gonna massage. You made it, you did it. So now we're gonna massage. What's your favorite topical to put on after?
I usually use the arnica gel, or we can use the
Face.
what? For hyaluronic acid.
Arnica does not horrible. I just think that you can get your patient to massage and kind of follow through at home. So it's nice to give them a better product that you sell that they would love the texture of, so that you can initiate, put your version, your bottle of it on them, so they feel it.
Get
And
the
maybe,
Toxelexer.
and you can package it with your
This is
package.
what we were thinking about that. Apply it, give it to them.
Yes.
And that's,
We'll apply your back bar
Yes,
and give
and
them
then
the
give
brand
them
new
this,
one,
yes.
right? What do you love for topical?
I mean, I like the Elastin, but
I know we're bougie, and so it's okay. So one time,
Zoe is also there in that room. Bring that one.
Zio has some good ones too. So I will say, Zio,
Yeah.
Zayn Obaji,
Yeah.
Zio,
Yeah.
yeah. I was here on.
I don't know why.
Yeah. So I think it's just, it kind of, it helps them understand that skincare is important, and that they leave here looking like moisturized, and you're doing something else that's helping from the outside, while what you just helped is helping from the inside. I 100% pair the Elastin Body, it's a big old one, with anything I do on your body, because if you think about it, just putting on moisturizer for your skin, which is something people don't do sometimes, will make that outcome look better, and then it's going to help with whatever I implanted. So I just like to hit it at all angles. So nothing wrong with arnica, unless you want to sell arnica at your practice, or or you like the texture. So but whatever you choose, because I do think you are what you attract, and if you think it's fabulous, they probably do too.
So Elastin from Zoe is what you use?
Elastin
No,
is a
Elastin is a
brand.
different company.
It is.
It's by-
Elastin is its own brand.
Oh.
by
Galderma,
Galderma.
well, they just bought it. They acquired it last year. But I will say, for me, Elastin has 2 hero products. One, Nectar. They just did, and if you carry, right? See, she's bougie too. I like it. If you carry Nectar, or if you carried anything from Elastin, the 2 things I would carry would be Nectar and the body cream that has Nectar in it. So they did a recent clinical study. You should ask your rep. The rep's probably gonna hate me, so she's gonna have to find it. But they did a punch biopsy on a forearm, not on any of us, and then took that out, plated it just like DermPath, had them use the Elastin, and then did a punch biopsy right next to it to show that you had an increase in elastin cells the name's silly, elastin, but that gene study is coming out, and it originated, the sculpture one originated from elastin and those people. So, elastin, see, I'm already messing up. But it shows that it's actually helping. So, you know, oftentimes we don't think that topicals are helping, so I feel like those are the two hero products. Is there any other product in your practice you love from them?
Those are the two that the skin
That like
nectar's
stand
wonderful.
out, right?
Yeah, because I have a lot of, I do carry Skin Better.
Skin Better's
Skin
fabulous
Better's
too. They sold!
Well,
Grrr.
L'Oreal had to.
I know, L'Oreal scooped that right up. But I think Skin Better also has some great products, like Alpha Red is
Alpha Red.
amazing. And the Intensive, isn't it good? And the Alto? Yes, I do love them too, but I say for
I don't like
Elastin,
the
those are,
sunscreen. It's just too chalky.
oh yeah, me neither. They're not my favorite.
You know what was this brand, which is not expensive, but their sunscreen is so good. It just blends so nicely.
What do you like?
It's this one.
Elta is doing.
Elta.
Yeah.
Well done.
Elta's fabulous. And Elta used
Yes.
to be alone in it. They also sold
I
to
know.
Colgate. So sad. But yes, theirs is better. I do think their sunscreen's better. So here you go on a massage and tell the patient 5 minutes, 5 times a day for 5 days. And we're hoping we get something. Or you can use the old one that's 2 minutes, 2 times a day for 2 weeks. So I tell my patients, especially if I sell them a cleanser that I really love, that I know they'll love, I did for sure do it with your cleansing morning and afternoon, shower, not in shower, I don't really care, because you already have a glide and it's nice and smooth, and then you can do one more time with your elastin or with whatever you prefer. So the massage serves 2 purposes. 1, to disperse the particulate, and 2, to increase the blood flow in that area to help them build their collagen type 1.
You know, I usually, like, sometimes I refer to people those vibrator or the massagers comes
or
like
the
I said
washer,
like
or
yeah,
the roller,
rollers,
the rose.
yeah, so I
Jay,
said that
do you
just
prefer any stone? Like,
Not-
not really, right?
yeah, I don't
As
like
long as
the
it's
stones
cold or
like yeah, as
whatever?
long as like as long as it's vibrating and straight and it can comes around the curves, that's what you need.
Yep, especially I feel like that's very fashionable to have it. I went to go get a lymphatic gua sha massage. I don't know how much it doesn't do, but man, does it feel good.
Yeah.
So I'm
I
into
use a
it.
massage. They came with this company called Pro or something.
Yes.
They have a different kind of a massage system. It goes exfoliation too. So I
Yes.
just use every day for the face wash. You know.
Perfect. And
Yeah.
that's a great idea too, because this is not like filler. So let's say we do, we can do, you can do the zygomatic arch and zygoma with filler, sculpture on her lower face, basically what we did. For other patients, you may find that maybe you want a little more immediate gratification and you can do some filler in the nasolabial fold, but you just explain to them where their sculpture is, so not on your cheekbone, but everything south of that, and you're gonna massage 5 minutes, 5 times a day for 5 days.
One
Any
more thing.
questions? You did great.
We can use the filler and the sculpture on the nasolabial fold at the same time.
Controversial. Only because filler precision matters, sculpture precision doesn't matter as long as it's in the correct plane. So I would say you may find that you might water down your filler because you're putting in so much volume of water. So I would do it, you could do it days apart, yes. I don't know if I'd do it in the same sitting.
Okay.
Are there people who blend the two and then almost do like a fanning effect everywhere, and they call it like glossing? They 100% do it. Look, I am a purist. I want to know if something messes up, I want to know what
What
messed
messes
up.
up, yeah.
So I would rather layer than blend, but there are people who do it. So you do you. You did great. You made it. Now you really have to eat some lunch so you don't pass out.
What about his? I was thinking of doing this spot on this thing.
Absolutely.
You know? So that it's
Brown get
nice,
mad?
Yeah.
Brown.
Do it.
Brown.
I'm always mad. I'm not like
Not anymore.
I'm not like mad, but like I look mad.
But I don't know that you
So
want to
I'm
take that
always
off
staring
because
at
it
people
kind of
like-
like goes with his persona. You know what I mean?
Yeah.
No.
I'm just joking. But I'm saying sometimes
I was like, yeah, but I don't want that person.
Right?
I find myself
Do
with
you
my
wanna be
pastor.
serious?
I'm staring at him at church like
like that.
he's like, what did I do? Yeah.
Well,
Yeah.
and something you also want to remember the occupation of your patient population. I have a lot of federal prosecutors, and the worst that you can imagine is someone who's trying to have some emphasis with zero expression in their face. So those people, I will realize that I'm going to have to let you wrinkle a little bit because you need to be effective. So
Yeah.
like your volume and your sculpture is going to be amazing, but I need to let you move. Try to be mad. Try to tell me something. That looks so silly. You're not going to be effective.
Can't even lift
You
your
know?
yeah, nothing happens in your face. Yeah.
No, you can't make people cry when you look like this the whole time. You know what I mean? So for their job, I don't challenge me. No, I'm just kidding. So you want to make sure that you say whatever's appropriate in their lifestyle. Perfect. But for you, we can soften it, for
I just,
sure.
yeah, make me look nice, please.
Yes!
I do like it better.
Easy enough.
I've worked it.
You did it.
Hey,
Thank you.
You're welcome.
Joey, you
I
did
worked
it.
an OR there.
Oh, very
Yeah.
nice.
You're welcome.
I'm excited to see the results.
I know.